A very good afternoon and a very warm welcome to today's panel discussion. We have all gathered here on the occasion of the International Day Against Drug Abuse and Illicit Trafficking, which was commemorated by the WHO in 1989. On the very day, the third convention against the illicit drugs trafficking in narcotics, drug and psychoactive substances was held in 1988. The aim of this convention was to guide countries to enhance their infrastructure and policies to control drug use and related crimes. I welcome our chief guest for the day, Dr. Vivek Sharma, Professor and Head of Department Physiology, beloved Dean Academics. I welcome you, sir.
Thank you.
I take great pleasure in introducing to you all our experts for today. We have with us Dr. Amit Singh.
Hello. Thank you, Dr.
He
Gayatri.
completed his MD in Psychiatry from King George Medical University, Lucknow. And he was my senior when we were doing DM in Addiction Psychiatry from the National Drug Dependence Treatment Center, AIIMS, New Delhi, which he completed in 2019. He worked as a technical expert following his DM in Harm Reduction Division for the National AIDS Control Organization under the Ministry of Health and Family Welfare, Government of India. And he's currently working as Assistant Professor, Department of Psychiatry at King George Medical University. I welcome you, sir.
Thank you, Dr. Gayatri.
Our next expert is Mr. Hariom Gandhi. He joined the CISF through the 1995 civil service exam. He's had a vast experience working in different positions in different cities in India and has managed several major airports as Chief of Airport Security. And he served as the Zonal Director, Narcotics Control Bureau from 2011 to 2018 in Gujarat and Maharashtra, and had a record number of drug seizures during his tenures. And he's presently working as the commanding officer and senior commandant of the 11th Reserve Battalion. And sir has been a champion for various environmental and public health issues, notably suicide prevention and mental health. I welcome you, sir. Our third expert is Dr. Bhavesh Modi. He's the department head for community and family medicine, AIIMS Rajkot. And he's been a member of several technical groups. His main area of thrust is tuberculosis prevention and policy making. He's the chairperson of the Indian Association of Preventive and Social Medicine and of the National Tuberculosis Elimination Program Core Committee. Sir has multiple publications, both national and international, and several prestigious awards. I welcome you, sir. And we're truly honored and blessed to have all four of you here with us. Before we commence discussions, I invite Dr. Vivek to enlighten us with his words of wisdom, sir.
Thank you, Dr. Gayatri. Good afternoon, all the panelists, the esteemed panelists, all the audience who have come over here to attend this wonderful program which Dr. Gayatri has organized over here. I congratulate Department of Psychiatry, AIIMS Rajkot, for taking effort on this day where we would like that everybody reminds themselves that drug itself and the illicit drug trafficking is a huge issue in the world. Professor Bhavesh Modi, my dear friend, Dr. Amit Singh, and as well as Mr. Gandhi, Hariom Gandhi ji. I really congratulate and I'm looking forward at what you speak during this webinar and enlighten all of us. The world today is actually passing through a phase of turmoil. All these things, the drugs, the economic turmoil, the poverty, and so much of the indecisiveness in the society are somehow interlinked. And also because wherever we find that there is economic turmoil, it also takes a shape in the lawlessness. And lawlessness is also definitely taking a huge part in the drug trafficking. And people also getting more and more looking for the wrong means of earning the money and taking it across the borders. So we need to take the policies. We need to first understand that drug trafficking is a huge thing, which is a multinational issue. It does not believe in the borders, and it is going to ruin, and especially the younger population. It is something which is going to affect more of the younger population of the world, although it goes through whole of the population across the world. So we need to know about it and what the policies are there. We need to contemplate also on how we can improve upon all the things that we are doing, how we can stop this drug trafficking at various levels. For example, at the level of the education, how we can educate the society that they don't fall into the quick rich scheme money part. Second, they do not fall prey to the drugs themselves. And then at then the other level, what are the policies, how we can take care of those policies, and then how the rehab can be done so that the people who have already fallen prey to it, they are not misused by the society, which is minting money out of it. So I again congratulate Dr. Gayatri, and I look forward and I wish all the best. And also would like to thank the panelists who have taken the time out to talk about this on this International Day of the drug trafficking and illicit drug prevention. Thank you very much.
Thank you, sir. I now invite Dr. Bhavesh Modi, Head of Department of Community Medicine, to brief us about epidemiology and major challenges of drug use in the Indian context. Sir.
Thank you, Dr. Gayatri. Thank you, Dr. Verma, and dear panelists. So on this special day, I think generally the days are identified so that as a symbolism, we do these panels or awareness. But I think we all agree it should be done every day, not a single day. But this is a symbolic day where we are giving more emphasis and using as to discuss various issues. So interestingly, if we look at the epidemiology, that means what is the prevalence all over the world and in India. Like in last year, 500,000 people died because of this drug use. And more than 18 million years are lost of healthy life every year. Also because of this drug abuse, increase in HIV and hepatitis are happening. And because of this, the entire activity is illegal. It is all black money, which leads to economic loss, social issues, so many other things. And as Vivek sir rightly pointed out, because of the COVID or because of the war, which is a theme for this year also, addressing drug challenge in health and humanitarian crisis. It's another bringing a lot major issue where because of COVID-19, around 100 million people went below extreme poverty. And more than 140 million people lost their job. So when situation like this happens, and including the Ukraine war and other thing, huge displaced population, which are very easy target for this, not only start using drug, but they start selling it or maybe cultivating it and many other issues. So it's a interesting challenge we are passing by, and for the same United Nations and come out with the Sustainable Development Goal. And the target 3.5 is specifically mentioning about substance abuse, which is titled Strengthen the Prevention and Treatment of Substance Abuse, including narcotic drug abuse and harmful use of alcohol. So these are two another major areas, not only narcotic drugs as substance abuse, but also harmful use of alcohol. And if we look at the international data, broadly, the substance is divided in three great categories. I think Dr. Amit will take in detail about cannabis, opioids, and opiates. Interestingly, most of the, if we look at the data, prevalence is more higher in Americas and Europe, if we look at in terms of percentage, and slightly lower in Asia and Africa. But when we convert that lower percentage of Asia into absolute numbers, it's a highest or huge population. But in terms of percentage, cannabis, North America, it is highest, almost 14%, and lowest in Asia, 2%. If we talk about cocaine, it is highest in Oceania, that is New Zealand, Australia, and lowest in Asia. Opioids, interestingly, highest in North America, and lowest in Europe. But though it is low in Asia, absolute number of people are high because of our higher population. And when we talk about new psychoactive substances, I think our psychiatric colleague will take care of that. This non-psychotic, new psychotic substances, they are quickly increasing in South Asia as well as in Africa, which is another huge challenge for us. And if we specifically talk about India, this cannabis and opioids, around 2% people are using it, which is also huge in terms of absolute number. But alcohol overuse is another major challenge, not only male, but also in female and children. And about bhang, ganja, charas, it is very high in Uttar Pradesh, Punjab, Sikkim, Chhattisgarh, and Delhi. I am not telling absolute percentage, but just giving overall figure. Same way about if we talk about another interesting category, specifically for India, in addition to the opioids and cannabis, is inhalants and sedative, which is another challenge. And this interesting category is not only higher in Northeast or some other specific pocket, but also UP, Maharashtra, Punjab, even Andhra Pradesh and Gujarat. So that's another challenge. This cough syrup or inhalants are used, which are for medical purpose. And interestingly, this is only category where not only adults, but children and adolescent prevalence is higher than children. So these are various challenges we are fighting with the displaced population, people falling below poverty line, availability of various. Also, people are shifting from regular traditional drugs. I was talking with Dr. Gayatri to a new synthetic drugs, which are easily available, and non-pharmacological uses are happening. So this is another challenge, that people are shifting from traditional substances which are natural to the artificially made substance, and also injectable drug use, sharing of syringe and needle, which is leading to not only drug abuse or dependence, but also spread of HIV and hepatitis. So there, it's a multi-pronged challenge, and I think we will discuss in detail. But the major challenges, according to me, specifically for India, is we have a range of issues, starting from very highly dependent, locally used things in Himalayas or Northeast, to pharmacy-based illegal factories selling newer psychoactive substances. There are many people, around 20% of the people who are using are actually in need, they are dependent, whom we can label as addict or dependent. There are no systemic treatment centers are available. Like for HIV or TB or malnutrition, we have all counseling centers and everything available, even below sub-district level. But when we talk about drug or substance abuse, very limited centers, and there are also many challenges. So availability, there is huge gap between availability of the treatment side of it. Also, as per my understanding, there is no national health program. It is entirely looked after by the Home Department. So a lot of supply reduction is happening. But what about the demand reduction? How we can ensure there is uh, drug-free village or drug-free schools or drug-free education institute? And I think Hariom Gandhi has done major work. He has visited more than 500 or 700 colleges and spread the awareness. So we need to address this not only from policy level to reduce the supply, but how we can also reduce the demand by spreading awareness, making the community empowerment. If we look at the data, interestingly, we say even our Honorable Prime Minister is also telling we have 2/3 of the population which is less than 35 years, which we call as a demographic dividend. But dividend is only we are getting if they are getting proper education, they are doing productive work and working for the economy. But imagine the same youth, if they are born in Afghanistan or Ukraine or such places, the same dividend can turn into demographic disaster. So I think that's a big challenge for us, how to make sure our younger children don't start it, which is a preventive part of it, by providing them that environment. And those who have started and become dependent, how we can ensure a system where there is community support, school support, peer support, as well as if required the treatment support from qualified psychiatry. Holistically, how can we address it? I think we'll discuss further in that direction. Thank you. Gayatri, please unmute yourself.
Sorry. Thank you, sir. That was very informative. Let's now begin with a slightly detailed discussion with our panel experts, Dr. Amit, Dr. Bhavesh, and Mr. Gandhi. I request all of our experts to please unmute themselves and switch their video on. Now, let's start by exploring why or how is drug use a medical, social, as well as a legal issue. Let's start with Dr. Amit. Sir.
Thank you, Dr. Gayatri. So to begin with, the life course of substance user or the substance use begin with a person using the substance. They experience a high, they continue to use it, and then they find it very difficult to abstain. They develop a dependence to that substance. So the first problem arises when a person becomes dependent over that substance. They find it very difficult to abstain from its use. Then with this substance use, there is associated health related issues. There is associated mental health related issues. So they develop a lot of variety of psychiatric problems, including depression, suicidality may be there. They develop psychosis with the use of several substances, including cannabis, bipolar disorders. Also, with the use of substances is associated lots of medical morbidities. With use of alcohol, we know there are lots of almost all the biological system get affected with the chronic use of alcohol. Similarly, there is with the use of tobacco and with other substances, especially with opioids. People often resort to injecting drug use. They even if they consume high amounts of opioids, there may be danger to their life. With injecting drug use, there occur transmission of a variety of bloodborne viruses and other infections. So this is the health aspect. Apart from the health aspect, when a person is spending lots of time to their substance use behavior, they find it very difficult to pay the same level of attention, or they somehow lose the focus over their work, their academics, and their day-to-day functioning. So it suffers a lot, leading to variety of social and academic and health, job-related issues. With financial issues and these familial issues, there occur often. There occurs conflicts at home, interpersonal conflicts increase, domestic violence increase, intimate partner violence, which we say nowadays. So it increases. Also, there are many legal consequences. If a person is found with certain substances, they may be put in jail. They are just illegal to even possessing them is illegal. So this is one legal harm. When a person is non-productive, almost all the domains in their life, they start suffering. They start getting adversely affected. So what means whatever it may be, their family, their relations, their occupation, their academics, their health, everything suffers.
Let's continue the discussion with Mr. Gandhi.
Yes.
Sir. I'll repeat the question. We were discussing about how substance use is a multifaceted problem with medical, legal, as well as social issues. What do we think, sir?
Yeah, because first of all, good afternoon to everyone. Dr. Vivek Sharma, Dr. Bhavesh Modi, Dr. Gayatri Bhatia, Dr. Amit, and all the participants. This World Drug Day, the illicit trafficking and misuse of the drugs. I think every day we are facing this problem, though this day is being celebrated from 1987 onward by UNODC. And at the time of when opium war started, when lots of tons and tons of the opium was destroyed during that war. From that day, this war against drug started. Unfortunately, every year when we are observing this, lots of programs are being conducted world over and in the country. The number of arrests, number of seizure, and the quantity of drug, it's increasing every day. And all of us would agree on this particular part. We are facing this challenge more acute in coming times because post-COVID, if we find lots of people got, there was a loss of job was there, then medical problem was there, isolation was there, then the new avenues come out, like the cryptocurrency started, Bitcoin. Then the darknet started. You need not to go to a peddler. You simply order through the Tor, that is a darknet. You pay in the Bitcoins, you get through the postal services. Now, once somebody is getting this and somebody is caught, the legal issue, the first thing, if you see, as per the NDPS Act, Section 8C, which prohibit cultivation, purchase, sales, transportation, warehousing, everything is prohibited under NDPS Act. Then the person who's consuming get attracted. 27, Section 27 comes in the picture. That means the person would be in the jail for 1 year. If the person is selling or he is conniving or financing, then the jail part goes 10 years to 20 years. Even if a person is caught again, then Section 31 is applicable. That means there would be death penalty would be there. So the act itself is very powerful. And if we see the agency around us, agencies are many agencies. The DRI is there, NCB is there, local police is there, Coast Guard is there, BSF is there. But still, the world over, if we see the business is around $700 billion. The money which is earned by this business is going to all top 10 crime. The terrorism is the biggest one. That Taliban taking over the Afghanistan, ISIS, Pakistani-based terrorists. So the youth of our country, 46 crore youth of our countries are really vulnerable because they are facing this problem. They never before had this because of, again, there are multiple issues like the family issues. One thing now unitary families are there. There is no joint family. If I am having the problem, whom I will be talking? Since I cannot talk anybody, I cannot express my feeling somebody. I feel, okay, let's have a drink. Let's smoke. The person who takes the drink or the smoke go to the next level very easily to the ganja. I think AIIMS did one survey in 2019 in association with the Ministry of Social Justice and Empowerment. They found in our country 3.1 crore people are consuming ganja, which is alarming. 2.3 crore people are using opium. Imagine if we catch all those people and put behind the bar, all the colleges and schools would be closed. So keeping all those things in the mind, we created a very wonderful initiative at my tenure in Ahmedabad. That was the healthy campus. हम लोग बोलते हैं ना कि अगर हमको एक कमरे में से अंधकार को दूर करना है तो क्या करना चाहिए? The very simple answer is आप लाइट जला दीजिएगा, ऑटोमेटिकली डार्कनेस गायब हो जाएगी. So drugs की प्रॉब्लम को अगर हमें खत्म करना है तो rather every time saying say no to drug, आप ऐसा मत कंज्यूम करो. आपको पता होगा टैबैको कंजम्पशन को रोकने के लिए सबसे ज्यादा जो पैसा खर्च होता है, it is done by the tobacco producing company. They are doing lots of advertisement, but still everybody is consuming it. Most of the people are consuming it, and they say, "यार नुकसान जब होगा तब के तब होगा, अभी तो मेरे को मजा लेने दो ना." The same theory is applicable with all the drugs. So now we have to involve our youth in something constructive. Maybe the social work in our healthy campus initiative. It was very interesting. In short, I can tell that 6 pointers were there. One was the healthy living. That was about the food, exercise, sports, and everything. Another was that we were involving our student in the social consciousness related activities. That means they were made to do work for the society. Plantation drive, Swachh Bharat mission, environmental cause, many causes we were involving them and making them brand ambassador. Like the same way, building self-esteem. Self-esteem was such a serious issue. People take it to build the self-esteem. आपने देखा होगा कितने सारे लोगों का हार्ट अटैक से डेथ हो रहा है आजकल. And many a time it is said people, those who are consuming the stimulant drug like the cocaine, methamphetamine, and acid, those are increasing the heart rate, and people many a time die because of that also. So that 6-pointer program was healthy living, social consciousness, stress-free life, self-critical thinking, and drug-free life. So this program is still running more than 550 schools and colleges of Gujarat and rest of the country. And apart from this, we included a corporate also, like the Infosys, Wipro, Vodafone, and TCS, and many more. And now I have included even our forces also in my CISF also, because mental health is becoming such a serious issue when people are thinking कि नहीं alcohol ले लो तो आपका tension कम हो जाएगा, smoking कर लो तो कम हो जाएगा. Then they do not know when they turn to the ganja, schizophrenia, then psychosis, and serious problems they are facing. Just Sushant Singh Rajkot case is very alive in our memory. कि how a promising star, ये सोच के कि post COVID जहाँ movies उनको मिलनी कम हो गई थी, बहुत सारे लोगों को, not only the movie star, even the general population, lots of people lost their job. So they thought यार easy आसान ये है कि दुख दर्द भूलने का कुछ drugs ले लो. But friends, let me tell you, this is not the way. Unless we keep ourselves engaged, something positive, something worthwhile, only then this drug abuse will be going out. Otherwise, only saying say no to drug doesn't help much, frankly. And request with the AIIMS doctors, come out with some kind of the things which we can tell to the student community, do this, and give some data, give some case studies कि बच्चे जो लोग गांजा ले रहे थे उन लोगों के साथ क्या क्या हुआ है. क्योंकि आजकल गांजा को लोग 17 से ज्यादा कंट्री जो है वो बोलती हैं कि ये तो लीगल है, कोई हार्म नहीं है. दिस इज अ मिस इन्फॉर्मेशन इज देयर. जैसे फाइलर करता है, ये तो शिव जी का प्रसाद है. बट दे नीड टू टेल ऑल प्रिस्क्रिप्शन ड्रग एंड द गांजा जो CBD उसमें इन्वॉल्व होता है, दे आर फॉर द पेशेंट, नॉट फॉर द जनरल पीपल. So that is my request to the doctors community, medical community, come out with some interesting ideas, give some case studies which we popularize among the student community. Yes.
Thank you, sir. That was a very comprehensive piece. I would like to now invite Dr. Modi, who is our social health expert, to please add something on the topic.
Thank you, Mr. Hariom. I think he has holistically covered majority of things, and in continuation, the last point which he said, I also came to know through our mental health officer that there is an initiative called Go Green, and that initiative is not about environment go green, but it's about making a bhang or this ganja legal product in India. And only in Ahmedabad there are more than 5,000 members of it, and that is happening running through our campuses. And I agree with Mr. Hariom that ये नहीं करना है, नहीं करना है, नहीं करना है. Like even kids also we keep telling ये नहीं करना है, but करना क्या है? I think that is what we need to address socially, providing that platform for sports, for extracurricular activity, or constructive participation in society rebuilding, whether it is plantation or cleanliness drive or any sports, and creating that communities, like in alcohol, we have alcohol anonymous group, people who have successfully quitted and providing support to everyone. Same way, how can we create those communities? How can we ensure family support instead of stigmatizing them and isolating them? How can we empower those families to support that affected person? Same way within schools and specifically college and our hostel campuses, how we can provide that positive club. Like for HIV, we have Red Ribbon Club. So how holistically we can create the system below the from ground level towards upside, and that was very successfully done in tobacco control program also. That if we talk about make India smoke free, it's very difficult. But if we can encourage the village sarpanch, and once people decide our village will be tobacco free, then it's easy to achieve. Then gradually that positive message is spread. Same way, this drug free proudly, how we can ensure from bottom up, from the community level, from the streets or from the societies, from the villages or from the wards, gradually we can move upwards, and how we can provide that positive networks, not the negative, but positive network of people who can support. I think that's the possible solution. And this positive case stories, studies, I think we should take up the champions who have come out of this, who got affected and able to leave this past and now positively working. That will be really spreading very positive message. जैसे जो शुरुआत में बात की, दिया जलाने का काम जो है अंधारा दूर करने के लिए. Thank you.
Thank you, sir. Very valid points. I just have one large question now. When we look at the bigger picture, while the medical fraternity roots for treatment and not punishment, the law enforcement agencies continue to have a very hard stand when it comes to substance use and related crimes. How do we view this? Let's start with Mr. Gandhi.
The problem with this, I think we have seen many famous cases of the celebrities. Whenever a case is booked in the consumption or in the possession, the first thing from their side is that we have not consumed. We were not possessing this. So it has to go for trial. When the case goes for the trial, bail takes its own time. Like in the case of many celebrities, it took 25 days, sometimes 20 days also. But there is a section in the NDPS Act, that is section 64A, that gives the immunity to the consumers and the small quantity people. If I tell the court and I tell the judge, sir, I'm sorry, I'm consuming this because I have become addict, I don't have any control on myself, then the court will order, send this person to the rehab or the medical treatment. But the condition is very important. You should take the treatment fully. If you miss the treatment, court will say, no, go there again and take the full treatment. Agar half treatment lenge to, that is not admissible. That is number one. Number two, court itself many a time punishing the people, like when somebody is consuming the cannabis, it is very difficult to catch a person. When police is catching a person, it has to go for medical examination, sample has to be sent, and many things are not completed. So people take the advantage of this. बोलते हैं यार कितने लोग consume कर रहे हैं, किसको कहाँ पुलिस पकड़ेगी? And even for the police also, if you see the day-to-day working of the police department, they are doing law and order duty, they are doing bandobast, kabhi koi communal right ho gaya, dacoity ho gayi, hundreds and hundreds of the cases under various act they are booking. So booking the case under NDPS Act, that too for a person who's consuming it, or many times a small time paddler, they find यार ये तो बहुत ज्यादा मुश्किल काम है, क्योंकि केस करना बहुत आसान है. But then they will be doing the investigation, then it will be going to the court, IO would be there, and many times IO is transferred. So there are many issues which many a time create hindrance, or rather are the deterrent. Say they don't do many cases, in fact, unless their seniors say कि नहीं drug का problem बहुत ज़्यादा बढ़ गया, you go and do the cases. So at the end of the day, जो बात हम लोग कर रहे थे, हमको उस पर work करना ही होगा. We have to catch the people at the top level. Because the drug trade is not such that if we start catching the consumer, we will end up catching the 10 crore people. UNODC also says that 5 crore people in the world, 5% of the people in the world are consuming the drug. So if we start catching the big people, big fish, big traders, big distributor, big cultivator, I'm sure this problem may come down. But at the end of the day, जो consumer है, Dr. Bhavesh Modi was also talking about the NPS, new psychoactive substances. When I am not getting the opium, I'll go to the substitute of opium. I'll start taking the cough syrup, or maybe the morphine. Hospitals में आप देखेंगे many times it is misused. Medicines are misused. Alprazolam and diazepam. Many painkillers are doctors ने prescribe किया कि आप 10 दिन के लिए लीजिएगा, and person is consuming. Then new psychoactive substances which are not having any legal implication, but they are mimicking the impact of the real drugs, and same damage they are causing, many a time more damage they are causing. So this is a very tough subject if you say in totality, but at the end of the day, the fault line here is, unless we are convinced कि इससे बचने का केवल एक ही तरीका है कि हम लोग अपने आप को किसी न किसी तरह से डिसिप्लिन में डालें, एक अपना ग्रुप क्रिएट करें। आई थिंक ग्रुप हैज अ वेरी पावर। बोलते हैं ना, पीयर प्रेशर ड्रग स्टार्ट करने का सबसे बड़ा तरीका है। सो द सेम पीयर प्रेशर कैन बी यूज्ड फॉर राइट डायरेक्शन। उन लोगों को हम लोग पॉजिटिव वर्क में लगाएं। इंस्टीट्यूट का बहुत इंपॉर्टेंट रोल है। इंस्टीट्यूट अगर उस ग्रुप को सपोर्ट करे, साथ साथ हम लोग फैकल्टी नॉमिनी जैसे उनके साथ अटैच करते थे, एक कैलेंडर ऑफ इवेंट बनाए और उसको रेगुलरली मॉनिटर करे। अच्छे बच्चों को हम लोग सर्टिफिकेशन देते थे, जैसे एनसीबी की तरफ से उनको सर्टिफिकेशन दिए जाए। क्लासेस वगैरह उनको डिफरेंट अटेंड करने के लिए कुछ एक्स्ट्रा मार्क्स दिए जाए, क्योंकि मैंने देखा है आजकल का जो यूथ है ना, रिवॉर्ड सीकर भी है। जैसे यार मेरे को क्या मिल रहा है इस प्रोग्राम को अटेंड करने का, हम लोग बोलते थे 2 पॉइंट मिल जाएंगे। एंड माइंड मी, आई गॉट फ्यू स्टूडेंट्स, जब हम लोगों ने प्रोग्राम कंडक्ट किया तो कुछ बच्चे मेरे पास आए थे, बोले सर यू आर आवर लाइफ लाइन। मैंने कहा क्या हुआ, वाई आर यू सेइंग कि मैं आपकी लाइफ लाइन? बोले सर आज हमारा पूरा ग्रुप शाम को प्लान कर रहा था कि हम सब लोग जाके गांजा और कुछ चरस लेके लेने का प्लान कर रहे थे, बट नाउ आफ्टर दिस सेशन वी प्रॉमिस यू कि वी विल नॉट बी डूइंग दिस। तो मैंने कहा प्रॉमिस तो ठीक है, तुमने कर दिया, तुम लोगे नहीं, लेकिन करोगे क्या? आपका एक चीज रोकना सॉल्यूशन नहीं है, लेकिन आप कर क्या रहे हो सकता है वो मोटिवेशन आपका केवल कुछ दिन तक रहेगा, बट आफ्टर दैट व्हाट? So my point here is this: whether it's a medical colleges, the non-medical colleges, everywhere human being are the same. आपको engage उनको रखना होगा। बड़ा सिंपल सा फॉर्मूला हम लोग इवन फोर्सेस में भी फॉलो करते हैं कि भैया शैतान को आप बिजी रखो, नहीं तो वो आपको बिजी रखेगा। सो कीप द यूथ बिजी। मोबाइल अगेन अ सीरियस एडिक्शन, हालांकि ड्रग एडिक्शन की हम बात कर रहे हैं, बट मोबाइल एडिक्शन आजकल उससे भी और सीरियस एडिक्शन हो चुका है। आप लोग डॉक्टर कम्युनिटी देख रही होगी किस तरह से सर्वाइकल, बैक पेन और बाकी प्रॉब्लम्स, आई से रिलेटेड इश्यूज आ रहे हैं बिकॉज ऑफ द मोबाइल, एंड दे आर बिकमिंग, बहुत जल्दी वो लोग मैच्योर्ड हो जा रहे हैं। इंफॉर्मेशन का जो एक्सप्लोजन है, अच्छा या बुरा मैं उसकी बात नहीं कर रहा, वो उन लोगों को पहले से ही उनका माइंडसेट फॉर्म करने में एक तरह से हेल्प कर रही है या नुकसान कर रही है, हम उसको देख सकते हैं। सो कमिंग बैक टू द सेम पॉइंट, कीप द पीपल इन्वॉल्व, अदरवाइज दे विल कीप द नेशन इन्वॉल्व। हमारा 46 करोड़ यूथ जो है वो हमारे ऊपर एसेट्स नहीं होगा, हमारे लिए लाइबिलिटी होगा।
Thank you, sir. We are running out of time, but I would still like Dr. Amit to address the issue. Sir, treatment versus jail. What do we think, sir?
So actually both have a big role to play while we are dealing with such a problem like that of a substance use, drug use, because while we are reducing the supply through various government agencies working towards prohibiting their sort of sale, trade, import, export and all, but what about the current users? And despite of all the efforts being made, still there will be several people who would be using the substance and developing dependence over the substances. So there is an equal role to play in by the harm reduction, demand reduction efforts. The demand reduction efforts including managing the patients who are dependent to substance, managing the patients who are not yet dependent, but they are likely to develop several complications over time. So they will reduce the people who are actually using the substance. The market will reduce, and which will lead to further reduction in the supply of illicit drugs to the population. So government, there are various government agencies working in this field. There are various programs addressing this issue, but like for opioid substitution therapy centers are there under National AIDS Control Program. Addiction treatment facilities are being established by Ministry of Social Justice and Empowerment. Similarly, earlier drug treatment centers were established by Ministry of Health and Family Welfare. So these are all focused on reducing the people who are actually dependent over the substance, who are consuming the substance. But somewhere there is some lack of coordination, even between the supply reduction and demand reduction efforts, and even the agencies which are involved in demand reduction effort. There is lack of coordination between let's say OST Center, Ministry of Social Justice and Empowerment run centers, and those run under Ministry of Health and Family Welfare. So a good coordination might help us achieving our goal towards reducing the use of drug use and a healthier society.
I agree, sir. Very valid points. And all of us, I'm sure, have gained something. I would have definitely requested someone from the audience to comment, but I think we're out of time. So I sincerely thank once again everyone for being a part of this occasion and attending the whole seminar with us. Special thanks to our experts and special thanks to Dr. Vivek, who's taken time out of his busy schedule and presided over the whole event. Thank you, everybody, and please have a nice day.
Thank you.
Thank you.
Thank you, Dr. Gayatri, for handling the session, starting on time and ending on time.
Thank you, sir.
Thank you. Thank you.